Good afternoon, everybody. So today I have a few updates before I turn things over to Dr. Martell for our public health update. Starting at the U.S. level, as we know, there's approximately 1.7 million cases of COVID in the United States. We have reported over 100,000 deaths in the United States. And a comparative on that is the University of Alabama football stadium holds about that many people. In our state, in the last 24 hours, there's been over 1,500 new cases of COVID-19. That brings the total to over 115,000 cases to date and over 5,000 deaths, sadly. Tomorrow, as we celebrate great progress and we move to phase 3, a lot of things will be opening back up in our community, and I know that'll be a subject of much discussion today. But it is also critical that we don't forget that this virus is still active in our community. As a reminder of how real this virus is, as of midnight, the state of Illinois has reported that there's over 3,600 Illinois residents who are hospitalized, over 1,000 who are in intensive care, and over 570 who are on a ventilator in the state of Illinois. We still need, as we open up, to practice social distancing, to wearing masks, and to washing our hands regularly. In a very real way, citizens, not public officials or even public health or medical folks, will determine how well or poorly the next several weeks goes. Nobody wants to see us go backwards or have to shut down things that will be opening up tomorrow. Nobody. The only way we get to phase 4 from 3, which will begin tomorrow, is if we continue to see positive trends with public health metrics. To that end, we have a shared purpose and goal that about a month from now, that we go to phase 4 on time and with momentum. Whether you have been in 100% agreement with what the president, the governor, or any local officials have done related to the COVID response, or if you've been in 100% disagreement, what matters going forward is that we do the basic things that we know has worked and helped us to flatten the curve. Social distance, wear masks, wash our hands regularly. And if you have symptoms, get tested right away. With that, again, I am personally very excited, and I want to thank the community for their hard work. We would not be going into phase 3 with the momentum we have, with the positive trends in public health metrics, if it wasn't for the hard work of many in our community. And that is very exciting to me. We have a really good lineup of speakers today with some really great updates. So with that, I'm going to quickly turn things over to Dr. Martell for the public health update. Thank you, Dr. Martell.
Thank you, Chairman, and good afternoon. Some things you're going to notice as you see the daily report. We are no longer going to be reporting total test and pending tests. That's because new sites are coming online, including pharmacy-based testing sites, and they will not be sending us all of the tests performed. Change in reporting by the community-based testing sites has also changed so that we are not getting total by county. So what we will get, as we always have, is our positive tests and our total number of negative tests, which really is how we determine the positivity rate. So that will not impact overall, but I think we know that we met the benchmark and the metric of at least 5% of our population having been tested. Changes to reporting on recovery are also coming. Currently, Winnebago County Health Department only includes those individuals who have had a positive COVID-19 test and have completed the required isolation period of 10 days and are reporting no symptoms and they're not hospitalized. We understand that the state will also be relooking at the metric, and as that comes to us, we will also be sharing that with you. So when we report that change, we will also be putting the notation. I want to put a special thanks out to the professionals from the 17th Judicial Circuit Court who have been assisting us in contact tracing, and they'll be returning to the court system on Monday as they begin their phased re-entry. Today we are reporting a total of new cases of 69, which brings our total case count to 2,062. We have no new locations of concern as today, and we are reporting a total of 640 recoveries. Unfortunately and sadly, we're reporting 4 additional deaths. 3 of which were associated with a congregate setting. That brings our total deaths to 58. We know that the deaths have disproportionately impacted those in congregate living facilities. And we recognize, along with the 100,000 deaths nationally, I've heard people compare it to influenza. But I want you to know and very clear on this, that COVID-19 is more deadly than seasonal influenza. Seasonal influenza also has an antiviral medication and a vaccine. We don't have this with COVID-19. What we have are the tools of social distancing, hand washing, sanitizing of surfaces, staying home when you're sick. In our seasonal flu, we reported from 2019 to 2020, 1 death from seasonal influenza. Compare that to 58 from COVID-19. We should not take this lightly. 58 families in our community are mourning the loss of their loved ones, and we mourn with them. So as we look forward in anticipation and with really some excitement as we move into our next phase, let us not forget those who are mourning in our community. Phase 3 for the North Central region of Illinois and for the Rockford region begins tomorrow, but we need to continue to be vigilant. Our community work groups have produced community standards, and I've had questions about, are they mandates, are they laws? These are the standards that our working groups have put forward, and for bars and restaurants, places of worship, and child care and youth programs, which are expected to be finalized tomorrow. We want the public to be aware that those are the standards that our sectors and businesses are putting in place to protect the health and safety of their employees and their customers whom they serve. But we also want the community to understand what the expectations of the public are in using those services. It's a two-way street. We collectively hold the key to reopening safely, and we want to continue on that progress. I want to introduce next John Groh, who's President and CEO of the Rockford Area Convention and Visitors Bureau, and Ann Weirda, Executive Director of Burberry Museum of Natural History, who are going to talk about our Clean Hands, Open Door campaign that supports the work in the Rockford region rebounding.
Thank you, Dr. Martell. Ann will join me in a minute, but to start, I want to thank the work of our public health officials, our government officials, and all of our residents for the efforts that they have undertaken and really the sacrifices that they've endured over the past months to bring us to this phase, entering phase 3 tomorrow. So what we'd like to announce today is a new regional multi-county initiative that we hope will help us safely, responsibly, and sustainably reopen our economy. Embracing the importance of a shared commitment to public health and our desire to safely reopen our economy, today we're announcing that a coalition of 16 organizations in Winnebago, Boone, and Stevenson counties are coming together to launch a new voluntary pledge that we will ask businesses and organizations to take. As Dr. Martell said, it is our Clean Hands, Open Door pledge. I think those words, clean hands and open doors, the most basic thing, we've heard Dr. Martell say this over and over again, that we can do is to adhere to cleaning hands and cleaning surfaces, but we've all been looking forward to opening our doors of our businesses and all of our organizations, our faith-based organizations and beyond. And so this pledge, we hope, will accomplish many things. I want to give you a couple of statistics. Right now, nationally, only 38% of residents nationwide feel safe going out for dining or shopping, and that's according to Longwoods International. However, according to Samari Insights, a national travel data company, 85% of consumers say that knowing the cleaning and sanitation protocols in a city and its establishments would make them feel more comfortable visiting and doing those activities of dining and going out for special occasions. And so this pledge today, which has been put together by the Rebounding Working Group of Hospitality and Tourism is intended to move us in the direction of safely and securely reopening the economy. There has been a lot of good work being done, and I appreciate the mayor asking Ann and myself to chair this group. We have more than a dozen individuals on our core group, and then another group of individuals from throughout Winnebago County on a restaurant task force, as well as a special event task force, working side by side with the health department on standards so that we can safely reopen. Again, this pledge, the Clean Hands Open Door Pledge, is intended to drive consumer confidence, but we can only do that if our businesses and our organizations of all types, not just tourism related, are willing to take the pledge and adhere to the pledge, and then share that they have taken the pledge and are adhering to these practices. There will be a website which is now live, rockfordcleanhands.com, where businesses and organizations can take the pledge, and then consumers can go online to determine who has who is voluntarily agreeing to adhere to these standards as they make their consumer-based decisions. Now I'd like to invite my co-chair of the working group, Ann Weirda, up, who will talk about the 7 pillars of this pledge and additional details for our public to know. Thank you so much.
Well, thank you very much. Thank you, John. I've appreciated working with you, and I'm excited about the Clean Hands Open Door Pledge that we're offering for our community. It's an important step to work together because we know that in the coming weeks there's going to be a lot of information that we need to manage and a lot of really exciting things that are happening as our community is excited to reopen. As the executive director of Burpee Museum, there are a lot of challenges and it will look different. So we want to make sure that we are providing those resources to the community, other businesses, and consumers so that when we can open sustainably and safely. We want to increase consumer confidence as well as the safety of our staff and employees within these organizations. By taking the Clean Hands Open Door Pledge, you will have a logo, the business will have a logo and a poster to mark that they've joined the pledge, as well as they'll be receiving additional resources and a fast track to information, things like posters they can post inside of their buildings, as well as updates from the Winnebago County Health Department, the CDC, etc. The major 7 tenets of the Clean Hands Open Door Pledge are the following. First of all, face coverings. We pledge to require staff to wear face coverings when interacting with guests, as well as customers wearing face coverings if they're medically able. We pledge to clean hands and implementing protocols, including hand sanitizing and hand washing stations for customers. We pledge to sanitization of our environment, following CDC guidelines for cleaning, sanitizing surfaces and equipment and other elements that will be interacting with both the consumer and the employee. We pledge to social distance, which is reducing our occupancy as necessary, ensuring that staff and guests are practicing social distance and they are adhering to the guidelines of 6 feet. We pledge to wellness checks, including staff conducting wellness screenings and limiting contact with other staff as necessary. We commit to training and protocols. This is going to look different. And I know in our organization we have to commit to different kinds of protocols, and certainly we need to implement those trainings to increase the well-being of everyone involved. And finally, we are pledging to public health guidelines. We're pledging to adhere to the orders and directives issued by the Center for Disease Control, the Illinois Department of Public Health, and of course our local county health department. This website, as John mentioned, is going to be available immediately, and businesses willing to take this pledge voluntarily will receive not only resources, but also hopefully help to increase consumer confidence as we adhere to the safety and well-being of our community. The committee really wants to share best practices, and rebounding with structures and resources in place for our businesses will help our region to work together with common goals and strategies. And this is critical for the safety of our community during this very important transition time. Thank you so much.
So first and foremost, thank you so much to Chairman Haney and Dr. Martell for their leadership and continued leadership, and also a very special thank you to both Ann Weirda and John Grove for not only their leadership at their own organization, but their willingness to provide a tremendous amount of time for the benefit of our community to chair the hospitality and tourism working team for our Rockford region rebounding teams. This is a tremendous pledge, and I certainly, and the city of Rockford, will certainly be taking this pledge. So these have been incredibly challenging times for our community. Every one of us has been negatively impacted by this virus. But through our good work, our collective good work, tomorrow we are moving to phase 3. As we come to the end and we start our new day tomorrow of phase 3, we're going to see parts of our economy reopen. And some of those parts are restaurants, bars, and social clubs for outdoor dining. All retail businesses will be open. All manufacturing will be open. Daycare and youth programming services begin to open. All state parks and camping will be open. Personal care services such as barbershops and salons will be open. So let's take a minute and let's celebrate how we got here. First, we got here by being vigilant. Then we also got here by listening to public health experts like our very own Dr. Martell. We've also got here through the tremendous brave work of our healthcare staff, as well as our first responders and our tremendous essential workers. Most of all, though, we got here as all Rockfordians and all Winnebago County residents working together. So as we enter phase 3 of the state's plan, let's continue that work together and show that same care, compassion, and patience for our fellow Rockfordians that has enabled us to get to this new phase. Let's all take the Rockford Clean Hands and Open Doors pledge. Our businesses have worked incredibly hard to ensure they will provide a safe experience for their employees as well as their cherished customers. I urge all Rockfordians to show some patience to our business owners. These small businesses, quite honestly, have been through hell and back. These are brand new times for them as they are for us. Please also shop local. When you shop local, it benefits all of us, and your dollar stays here a lot longer and goes even further. We are really thrilled to be entering this new phase, but I have to tell you, we still want you to remain cautious. As the chairman stated, the virus doesn't really care which phase we are in. It is as contagious today as it was on March 12th when we opened the Emergency Operations Center. We have seen how not to open, quite honestly, if you look down south at the Ozarks or even to our friendly neighbors to the north in Wisconsin. Just yesterday, Wisconsin announced a record number of cases and deaths for a single day. A phased plan, although at sometimes a little bit painful for all of us, is the most responsible and sustainable approach for us to reopen our economy. So please continue to wash your hands, practice social distancing, and wear your face covering. Wearing your face covering is about respecting and protecting others. It is the right thing to do. Also, remember, the reopening is just truly the beginning of Rockford's rebuilding. Let's not just reopen, let's rebuild so our community is stronger than we've ever been before. That is our ultimate goal. So let's take notice. Let's look at this once in 100 year pandemic and crisis that we've all faced and turn it into this once in 100 year opportunity so we can be a stronger city, all of us together. So please remain vigilant, remain hopeful, and please shop locally and consider taking this important pledge that John and Ann laid out for us. And at this time,